I mean, I think our submission speaks volumes in terms of a body of medical evidence. So I'll just add a few top-line comments in a couple of minutes to that. So I'd just like to remind the committee that MSF's role here is to advocate for our patients and former patients, and to highlight where we see structural issues that cause harm or that obstruct appropriate access to medical care and so unnecessarily exacerbate suffering. This is our role in all of our operations worldwide. Our submission is focused on our experience in Nauru, and especially the medical data and analysis that came from those independent medical operations that we performed. We put it to this committee that this evidence, along with the evidence of the number and severity of referrals to Australia as part of the recent MedEvac process, clearly corroborates the severity of the health crisis we saw and the urgency to address that health crisis. Currently, the legislation under review is the most effective mechanism for doing that. It is clear to us that despite significant resources coming from the Government of Australia and some resources from the Government of Nauru, the medical and mental health crisis has continued to deteriorate. Our experience sheds some light on why these resources could not prevent this from happening, and why, therefore, timely, effective, and clear means of medical evacuation became necessary. So, in a nutshell, our key findings. 1. MSF data and medical experience with patients on Nauru demonstrates that dangerous mental health impacts are a predictable consequence of the operation of Australia's border protection policies, insofar as they continue to keep people indefinitely contained on Nauru. MSF's findings led us to conclude that curative treatment for the overwhelming majority of cases was not possible, whilst the key stresses of isolation, family separation, and lack of control over one's own life remain present. The mental health services available on Nauru, and I refer to the Republic of Nauru Hospital, IHMS and MSF, were not able to deal with this level of mental health crisis and the specialised care therefore required. And that since our departure, the MedEvac referral process provided for in the Migration Amendment Medical Transfers legislation has been the most effective medical referral pathway for patients from PNG. But it is currently handicapped in its operation for patients in Nauru by the Nauruan Government's unwillingness to facilitate timely transfers of approved patients or authorise tele-health consultations from Australia. In our submission, we raise questions as to the appropriateness of the current setup of services in Nauru for mental health. We only caveat these observations by recognising that MSF has only a partial information about the operations of IHMS and the Republic of Nauru Hospital. However, our experience of working on Nauru raised serious enough doubts that this committee, and indeed the Australian public, need to be aware that there are fundamental structural issues preventing the operation of adequate mental health services of Nauru for the asylum seeker and refugee population.
I won't keep you long, but I'm just interested to know if you could explain why on the 5th of October last year the Nauruan Government informed MSF, and you say here without warning and in breach of the 3-month notice clause of the MOU, your services were no longer required.
Yeah, I mean, it's conjecture for us to really hypothesise as to what fundamentally was going on. But I think our services were high quality, they were effective, and as such we were becoming increasingly in demand. At the point of leaving, we had over 100 patients on a waiting list to be treated by our medical team. So when that decision was made, it was very clear to us that I think our services and the role that we were playing on the island, and the fact that we were becoming increasingly aware as to the extent of the mental health crisis, and the fact that in fact curative care, however many doctors you put on the island, is not going to be a solution so long as the underlying issues that are driving these traumas in the first place continue to be present. I think it was a culmination of things that then resulted in a clear decision to cease the activities of Médecins Sans Frontières, so that we were not in a position to be able to expose this fundamental reality, this health crisis, whilst on Nauru.
So let's take it back. You entered into an MOU or a contract of some description in November 2017. Is that correct?
That's correct.
And what was the purpose of that MOU? What were you required to do?
It's what we call an open door policy. So we would treat anyone with mental health disorders on the island, irrespective of their background, whether they were Nauruan nationals, asylum seekers, refugees, or even international staff.
So it's a general, it's not just persons that were sent there by Australians, it included Nauruan citizens.
It's a clear open door policy to anyone. The only criteria was whether you were suffering from a mental health disorder and the severity of that disorder.
And these services were provided free?
Absolutely free.
Mm-hmm. So who paid you?
We're supported by the general public, so 100% privately funded.
Philanthropy?
Yes.
Mm-hmm. Were you paid by the Australian government?
No.
So your services were entirely funded by donations?
That's correct.
Mm-hmm. And your contract, the MOU was renewed in May of 2018?
That's correct.
Mm-hmm. Were there any criticisms raised at that point?
No, quite the contrary. In fact, I participated in a meeting directly with the then President Baron Waka myself, where the team presented an update of our progress and highlighted the concerns and issues we'd identified for both the Nauruan and the asylum seeker refugee population in a cabinet meeting. And we presented with full transparency our concerns. We reached an agreement to continue running our operations. I was present with the team on Nauru for that meeting.
So within 5 months, your contract is cancelled?
That's correct.
Do you think there was any pressure from the Australian government?
I honestly cannot submit any conjecture.
That was the only point of reference, was it? You say without warning. Is there no indication at all that people were unhappy with your services?
We were given 24 hours notice to cease our activities, whilst the MOU had a provision for 3 months, and most importantly, the provision to ensure follow-up with our patients. So any medical practice would require a period of time by which our patients could be appropriately transferred, informed of the changes that were taking place, ensure there could be a transfer of responsibilities, medical data, etc. We were given no opportunity to fulfill even a minimum level of medical responsibility towards our patients on the island.
Okay, well, so there were no complaints from any other source about your operations?
There were certainly challenges in the way we were working. We were trying to secure access to patients. We had repeated challenges in terms of referral and counter-referral with IHMS, sharing of medical information and data, the use of our facilities. All of this is kind of regular standard fare for any operation in a difficult resource poor setting.
Mm-hmm. Now, upon advice that you were to cease operations, you established a tele-mental health service. Why did you do that?
John, do you want to talk to me?
It was out of a sense of responsibility for continuity of care for those patients that we had been cut off from. And remember that our operations were a mental health operation. And as we've mentioned in our submission, that there were some serious blockages for those patients in terms of accessing therapeutic mental health care that they could trust and that they wanted to engage with. And it was for that reason that we attempted to, of course, it's not a replacement, we should be clear, it's not the same quality that was being able to offer in person, but we attempted to set up that service so that at least some continuation of care could be delivered, even if that care, the ambition in terms of the impact on the patients was relatively modest.
Mm-hmm. But then again, on the Friday the 22nd of February, the Government of Nauru issued new regulations prohibiting the practice of telemedicine in the country.
That's right.
Were you given any reasons for that?
No.
No, we weren't actually made aware of that. We discovered that and were, of course, forced to act in accordance to that new legislation, which was essentially prohibiting the last foreseeable means to maintain the opportunity for patients to reach out to medical professionals that they had already established a relationship with who were no longer physically present on the island.
Okay, now having said all of that, you say then there was a mental health crisis developing on Nauru for at least 4 years, and that severe cases of mental health regarded as severe depression, anxiety, and various other matters, were they brought to the attention of the Nauruan government?
Yeah, absolutely. I mean, for us, we work all over the world, in many detention settings, in many containment settings, offshore processing settings. It is entirely predictable that the indefinite detention of a population will result in these kinds of traumas, mental health problems. It's well documented and well known. So from our perspective, working in a context like this, what was unique was the longevity. It's been raised already today, the longevity of this containment and this uncertainty. So certainly it was not a surprise for us to find severe levels of mental health disorder. The fact that we would find some of the most severe levels of mental health disorder we've ever experienced as an organisation was a complete surprise to us. But yes, this was conveyed. Like I say, I participated in a meeting directly with our team where we presented the outcomes of our initial findings to President Baron Waka at the time.
Mm-hmm. And were these findings made available to the Australian government?
At that time, no. We were in no operational relationship with the Australian government. We did repeatedly reach out to offer to update the Australian government on our findings, particularly after the decision from Nauru to terminate our services. It was only 6 or 7 months later, that we finally actually secured a meeting with Home Affairs to talk about our concerns.
I see. And who in Home Affairs did you manage to meet with?
It was with the Deputy Secretary, Sherilyn Moy.
I see. It took 7 months to get an appointment.
It's the day before the federal election, I believe.
Oh, I see. The day before. And what was the response of the assistant? Was the Assistant Secretary, you say?
Yes, I believe so.
What was the response?
It was a brief meeting. I was in that meeting with our international president, and we shared, of course, the report that we released that was included as an appendix to our submission to this committee. They noted the report. They listened politely to our concerns, but there was not very much more, I would say, of meat to that meeting.
So, having sent that report through to them and providing it in person, what do you say to the proposition that the department has put to us that there's been an increase in the level of self-harm that they quote, particularly in New Guinea, but in terms of the suggestion of self-harm amongst the refugee population? What do you say to that proposition?
Well, I mean, I'd like to ask Dr. O'Connor, but I mean, no, it comes as no surprise to us. I mean, as long as the circumstances which are driving the deterioration of the mental health condition of these people remain the same, which is that they're isolated, they have no freedom to decide, make choices over their own lives, they're separated from their families, etc., their condition will continue to deteriorate, irrespective of whether you put healthcare at their disposal or not. That's unfortunately a reality. There will be no clinical solution to that problem, which is why we, MSF, call for the immediate removal of everyone from that situation and circumstance, because it is causing harm and it will continue to do so. But in the absence of removing these people from that situation, absolutely an avenue to ensure that those who are sick and need a level of care that's not available on Nauru or PNG, such an avenue has to be made available, and it has to be at the determination of medical professionals.